A 360 view of the room. Hi, my name is Lisa Roth, Lisaroth. I'm a student nurse in PNE203 at Seneca College. My student number is 118-437-185, and I am going to be performing my head-to-toe assessment. I'm going to start by performing proper hand hygiene. When I do this, I'm going to don a pair of clean gloves, and then I'm going to use a alcohol swab to clean my stethoscope. I'm going to begin with my introduction. Hi, my name is Lisa. I'm a student nurse here at Seneca Hospital. Can I perform a head-to-toe assessment on you today?
Yes.
I'm going to check your wristband to confirm you're the proper patient. Can you state your full name?
Robert Roth.
And your date of birth?
November 20th, 1966.
Perfect. The patient seems to be the correct patient stated on the documentation. Now, are you in a comfortable position?
Yes.
Do you need to use the bathroom?
No.
I'm going to close the curtain for privacy. I'm going to begin by a general assessment of the physical appearance. The age and skin color seem to be appropriate for that stated on the documentation. No signs of any physical odor. For behavior, the mood is appropriate for the given situation. The patient came and dressed appropriately for the weather and situation. Their speech has been clear and concise. They're able to look me directly in the eye and make eye contact. For body structure, their body is broad, their body fat is evenly distributed, and there is no signs of any physical deformities or involuntary movements. Next, I'm going to be assessing for mobility. If you can just stand up and walk towards me, please, for gait. Perfect, and then back to your chair. I can assess that the arm swing is symmetrical and even. There's no signs of any crepitus, no altered range of motion. Next, I'm going to be assessing your range of motion. If you can flex your arms and extend, perfect. When you do this, do you have any pain?
No.
Perfect, no pain, no altered range of motion, and the movements are clear and concise. Next, I'm going to be assessing for work of breathing. When I assess for work of breathing, I see no signs of distress, no signs of any labor. Do you know, for level of consciousness, do you know who you are?
Robert Roth.
Do you know where you are?
Seneca Hospital.
Do you know what today's date is?
April 13th, 2021.
Perfect. So the patient is alert and oriented and awake ×3. Next, I'm going to be starting my assessment with the head. When I assess the head size, the size is equal in proportion to the body and composition. When I assess for shape, it is normal cephalic. Do you feel any pain?
Nope.
No pain, no swelling, no tenderness, no nodules. For hair, it is evenly distributed. It is dark in color. There's no signs of any foreign bodies or infestations. I'm now going to assess the face. When I assess the face, I can see that it is symmetrical. There is no involuntary tics, no involuntary movements. I don't see any masses or lesions at all. When I palpate the frontal and maxillary glands, do you feel pain?
No.
No pain, no, just a bit of pressure. Perfect. Now I'm going to test for cranial nerve 7, which is the facial nerve. When I test for this, can you smile with no teeth? Smile with your teeth. Puff out your cheeks and close your eyes tightly. Perfect. So there's no involuntary movements. They're all deliberate. Cranial nerve 7 is intact. Next, I'm going to be assessing the eyes. When I assess the eyes, I'm going to be assessing the eyebrows, the lids, the sclera, the conjunctiva, the eyeballs, the pupils, and the lashes. When I assess the eyebrows, I see that they are symmetrical. The eyes are shaped symmetrically. They are rounded. The lashes are evenly distributed. There's no crusting, no signs of any swelling, no redness. Now I'm going to be assessing ocular motor nerve 3, which is cranial nerve 3, which is the oculomotor nerve. When I do this, I'm going to be using the acronym PERLA. I'm going to assess for pupil size, which is 5 mm. I'm going to assess for consensual and direct light reflex. When I do this, can you look forward, please? Perfect. Perfect. When I do this, the patient's pupils constrict and dilate. When the light hits the pupils, they constrict, and when I move it away, they dilate as they are supposed to. Next, can you follow this towards your nose? Oops, sorry. Perfect. And when the patient does this, the eyes converge and the pupils constrict as they are supposed to, which confirms that cranial nerve 3, the oculomotor nerve, is intact. Next, I'm going to move on to the ears. When I move on to the ears, I see that the shape is symmetrical. I feel any pain on the tragus and auricle. Any pain?
No.
Perfect, no pain, no tenderness, no signs of discharge or crusting. I'm going to perform the whisper test, which is where I whisper 3 words in each of your ear, and I'd like you to repeat those words back to me, please.
Car, truck, bus. Orange, apple, banana.
Perfect, so the whisper test was successful. I don't see any signs of any tremors there. Next, I'm going to move on to the nose. When I assess the nose, I see that it is midline. The nostrils are symmetrical. I don't see any discharge or crusting. Next, I'm going to assess the mouth. When I assess the mouth, I'd like you to keep it close so I can assess your lips, please. When I assess the lips, I see that they are symmetrical. There's no swelling and no lesions. I also see that they are well hydrated. Can you open your mouth, please? I'm going to assess the gums. I see that they are pink. There's no redness, no bleeding, no swelling. I assess the teeth. There's no looseness. They are evenly distributed. When I assess the tongue and the hard palate, can you use the roof of your tongue to your mouth, roof your mouth? Perfect. And I see that the hard palate the hard palate is intact, and it's pink in color. There's no signs of any lesions. Next, I'm going to be testing for cranial nerve 9 and 10. That is the glossopharyngeal nerve, the glossopharyngeal and the vagus nerve. When I test for this, I'm going to have you open your mouth. Perfect. And say ah.
Ah.
Perfect. So when I test for this, the uvula and the hard palate move up and back, which means that the hard and soft palate are intact, which means that cranial nerve 9 and 10 are intact. Next, I'm going to be assessing the neck. When I assess the neck, I see that it is midline. I want to palpate. Do you feel any pain?
No.
No pain, no tenderness, no lesions. Temperature is warm. I see that the thyroid is not enlarged abnormally, and the neck accessory muscles are symmetrical. When I do this, I'm going to now test for cranial nerve 12. Cranial nerve is the spinal nerve. And I'm going to apply resistance. Can you turn your head left? Perfect. And then right? Perfect. And shrug your shoulders. Awesome. So cranial nerve, do you feel any pain?
No.
Perfect. So cranial nerve 12 is intact. Next, I'm going to check your carotid arteries for pulses. So when I do this, I'm going to do each side individually for 60 seconds. When I do this, I'll find that it's 60 beats per minute. The grade strength is +2, and the rhythm is smooth and equal bilaterally. Next, I'm going to move on, and I'm going to assess the upper extremities. When I assess the upper extremities, I see that the hair is evenly distributed. Do you feel any pain?
No.
No pain upon palpation, no tenderness, no lesions, no signs of swelling or edema. I don't see any scars. The temperature is warm, and I don't see any involuntary muscle movements. Now I'm going to get you to test your range of motion. When I test your range of motion, I'm going to get you to bend, flex your arms, perfect, extend your arms, perfect. Range of motion is deliberate, no altered range of motion. Next, I'm going to assess your fingers. When I assess your fingers, I see that the nail beds are curved and rounded. The nails are smooth and curved as well, and there's no signs of any lesions. Next, I'm going to be assessing your radial pulse. So if you can turn your wrist over for me, I would do both at the same time bilaterally for 60 seconds. When I do this, I would notice that it is 60 beats per minute. The grade strength is +2, and the rhythm is smooth and equal bilaterally, so I have no concerns. I'm now going to test your hand grip strength. When I test your hand grip strength, can you squeeze? Perfect. It is strong and equal bilaterally. I'm going to get you to stand up to test active range of motion. I'm going to start with your fingers. Can you flex your fingers? Perfect. Extend your fingers. Awesome. Flex your wrists. Awesome. Extend your wrists. Awesome. Then I'm going to do ulnar deviation, radial deviation. Perfect. I'm going to get you to flex your elbows and extend your elbows. Perfect. We're going to do supination. Perfect. Pronation. Perfect. And then I'm going to get you to do shrug your shoulders, and then I'm going to get you to abduction, and then adduction, and then internal rotation and external rotation. Did you feel any pain?
No.
Perfect. So if you can take a seat, all range of motions were smooth, deliberate. There was no pain. So I have no concerns there at all. Next, I'm going to move down to the lower extremities. When I assess the lower extremities, I see there's no swelling or edema. Do you feel any pain?
No.
No pain, no tenderness, no swelling, no lesions, no scars. I feel the temperature is warm. There's even hair distribution. I don't see any signs of muscle bulk and no involuntary movements. I'm going to be assessing the posterior tibial pulse. When I do this, I would assess both at the same time for 60 seconds. I would realize that it is 60 beats per minute. It is smooth and equal bilaterally, and the grade strength is +2, so I have no concerns. I'm now going to check for the dorsal pedis pulse. When I check this, I would check both at the same time. I would do that for 60 seconds, and I would realize that the grade strength is +1, so it's a little bit weaker. It is still smooth and equal bilaterally, but the rhythm is a bit weaker because it is a difficult place to palpate. But I still don't have any concerns there as of right now. Next, I'm going to be checking for your dorsal and plantar flexion. Can you move your feet up? Perfect. And then down? Perfect. So it is strong and equal bilaterally. Did you have any pain?
No.
Perfect. So I just performed hand hygiene again. And now I'm going to start by getting you to stand and turn around so I can auscultate your posterior thorax. To auscultate the posterior thorax, there are 9 areas. I'm going to have you take a deep breath in and out, in and out, in and out, in and out. Perfect. So as I auscultate, I have here no wheezing, no signs of cackling, so I have no concerns that the lungs are not clear. When I assess the posterior thorax, I see that it is midline and symmetrical. I'm going to assess here any pain.
No.
No pain, no swelling, no tenderness. Temperature is warm. I don't see any skeletal deformities. Can you take a deep breath in? Perfect. And out. So there's even chest expansion. I know this because my thumbs move in and out as he breathes with him. Next, I'm going to have you turn around and face me so I can auscultate and assess the anterior thorax. I'm going to have you take a deep breath in and out, in and out, in and out. Perfect. So when I do this, I hear that there's 16 breaths per minute. I don't hear any wheezing or cackling. The breath sounds are equal and symmetrical. I don't have any issues with that. Next, I'm going to continue to auscultate the anterior thorax, but I'm going to start at the second intercostal space of the right sternal border. So when I do that, take a deep breath in, perfect. And then I'm going to move over to the left second intercostal space of the left sternal border. I'm going to move down to the third intercostal space of the left sternal border. So I went from the aortic valve area to the pulmonic valve area. I'm now at the Erb's point area. I'm going to move down to the fifth intercostal space of the left sternal border. And this is I'm going to move down to the fifth intercostal space of the left sternal border, the left medial clavicle, which is the mitral area. When I listen, I don't hear any issues there. I'm going to go back here and listen and auscultate for the apex pulse. When I do that, I would listen for 60 seconds, and I would find that there's 75 beats per minute, and it is smooth and even and clear, so I don't have any issues with that. Next, I'm going to say that the S1 is best heard at the apex of the heart, where the tympanic and mitral valve are, and then the S2 sound is best heard at the base of the heart, where the aortic and pulmonary valve are. Next, I'm going to have you go over to the bed here. So I'm going to do an abdominal assessment. I'm just going to properly drape the client. Are you comfortable?
Yes.
Perfect. Get your feet in there. Perfect. I'm now going to be assessing the abdominal quadrants, all 4 quadrants. When assessing, I see there's no signs of swelling. I see symmetrical. It's symmetrical. I don't feel any lesions. Do you feel any pain?
No.
No pain, no tenderness, no edema. The temperature is warm. Next, I'm going to be auscultating for bowel sounds. So I'm going to do each quadrant. I'm going to start with the lower left quadrant, and then go to the lower right quadrant, to the upper right quadrant, and the upper left quadrant. When I do this, I'll notice that bowel sounds are gurgling, they are hyperactive, and this tells me that the bowel sounds are running and working smoothly. Now when I auscultate, when I palpate, I'm going to start palpating from the left lower quadrant. Do you feel any pain?
No.
No pain, no tenderness, no pulsations. When I do the lower right quadrant, any pain?
No.
No pain, no tenderness, no pulsations. The upper right quadrant, any pain?
No.
No pain, no tenderness, no pulsations. The upper left quadrant, any pain?
No.
No pain, no tenderness, no pulsations. Perfect. Next, I'm going to palpate the bladder. When I do this, do you feel any pain or discomfort?
No.
No pain, no discomfort. So there's no distension, which tells me that he is okay. And that's the end of our assessment.